All people in public must have a mask or nose covering.
Now at 6, cover up. The new rules for New Yorkers if you have to leave your home.
A huge break for healthcare workers. The homegrown COVID-19 test now being used only in the tri-state area.
And price spike. The ambulance workers claiming they're being charged triple for critical PPE by the town they're trying to save. Good evening. I'm Chuck Scarborough.
And I'm Natalie Pascarella. President Trump just announced that tomorrow the White House task force will announce guidelines to reopen the country after coronavirus. New York State is reporting 752 more lives lost because of the virus and almost 12,000 more cases. The state will soon include presumed coronavirus deaths as well. Those are victims suspected of having the virus but who were never tested. But some good news today as well. The number of people hospitalized because of the virus is down again. And this just in, the MTA now requiring all people who ride the subway to wear a mask starting Friday. It comes after the state ordered all New Yorkers must now cover their face when social distancing isn't an option. Essential businesses are ordered to provide those masks. Governor Cuomo says that state-run antibody testing for healthcare and essential workers is set to begin, testing 2,000 per day. Now, that plan is to increase this to 100,000, identifying those who have recovered and then developed a possible immunity. The coronavirus now infecting 2 million worldwide, almost 300,000 in the tri-state area. We go now to News 4's Miles Miller live in the East Village with the fight to keep those essential and very important frontline workers safe. Miles.
Well, Natalie, as you just said, the MTA now requiring everyone to wear face coverings, and for good reason. You talked about keeping those essential frontline workers safe. Some 50 of MTA workers have died from coronavirus, so they want everybody to cover up. Masks and face coverings mandatory in New York.
Don't infect me. You don't have a right to infect me.
Governor Andrew Cuomo ordering everyone to carry something to cover their face and wear it when others are less than 6 feet away.
If you're going to be in public and you cannot maintain social distancing, then have a mask and put the mask on.
Tonight it's happening at all essential businesses. They must provide masks to employees and everyone needs to wear them starting at 8 p.m.
There is such uncertainty, there's such confusion, there's such a sense of insecurity.
Mayor Bill de Blasio making his own plea for masks today, asking grocery stores to ban shoppers who won't wear them. Store owners say enforcing these new rules is tough.
We try, we lost a little bit business, but the law is the law.
At the same time, there's new help on the front lines. The NYPD rolling out a pilot program at precincts across the city, taking the temperatures of each officer as the virus sweeps through the ranks. And no public agency's been harder hit by COVID-19 than the MTA. More than 50 employees have died from the virus. Today, the agency announcing a deal with Northwell Health to provide testing for those who are symptomatic.
They are stepping up and making the same sacrifices as any first responder during this crisis, risking their health in the name of public service.
And the MTA chairman telling riders to spread out on the platform, wait for the next bus or train if the car or if the bus has way too many people inside. The bottom line is that we all have to change our behaviors, and he's saying that starts on Friday. We are live in the East Village. I'm Miles Miller, News 4 New York.
All right, Miles, thank you very much. A new battlefront for the city, hunger. Mayor de Blasio announced a $170 million initiative to feed those having trouble getting food during the pandemic. This plan includes using thousands of TLC-licensed for-hire drivers to deliver those meals, as many as 25 million meals over the next month and a half. News 4's Rana Navini is live in Long Island City right now with just how all this is going to happen. Rana?
Yeah, and Chuck, the mayor announcing that plan today to help feed New Yorkers, and he says he wants to pay particular attention to children, seniors, and those who are homebound. At New York City soup kitchens, the lines are longer than ever.
It's so busy, it's a lot of people. The line is going to come in more and more, so we need more food.
That's important for everybody. Too many people don't have money for buying food.
People wrap around the block outside First Baptist Church in East Elmhurst, waiting for a grab-and-go meal and maybe some fresh produce. The church serving hundreds more people than it normally does.
It was increasing before, But now it's really because a lot of people are laid off.
In Bed-Stuy, Brooklyn, another mobile market. This one run by City Harvest, who's made a point to try to reach the city's NYCHA communities.
Somewhere in the neighborhood of 500,000 New Yorkers have lost their livelihood in just the last few weeks, and money's running out.
Mayor de Blasio is laying out a $170 million plan to combat hunger, including hiring 11,000 TLC drivers to deliver meals, earmarking $50 million for an emergency food supply, and pledging to provide PPE to grocery store workers.
I want to just say thank you to them first. You know, they are among the groups of unsung heroes in this fight.
In Midtown, another effort to combat hunger. Diana Lee and Matt Woodruff are behind Do Good Auto Coalition, urging car dealers to donate cars and drivers to help deliver food to those in need. Maserati is on board. Volunteers loading the luxury cars with excess food from local restaurants.
There should be from 1,000 to 2,000 pounds of food items that would otherwise go unused and be thrown away.
We don't do what we need to do right now and get the food supplies to them. There's going to be more death.
The food they picked up ending up at a food bank in Brooklyn. Once again, the site of long lines of people waiting for a meal and waiting for an end to the pandemic. And the city says it expects to help serve up to 10 million meals in the month of April and up to 15 million meals in the month of May. Reporting live in Long Island City, Rana Novini, News 4, New York.
Rana, thank you. In New Jersey now, the numbers just keep rising. Reported deaths went up by 351 in 24 hours, and new cases are up almost 3,000. And today, the country's first saliva testing site opened in New Jersey, and you can bet we saw long lines. Just look at that there. News 4's Brian Thompson live in Edison with how this could make testing safer, Brian.
Yeah, well, they're certainly hoping so. Testing has always been the key, of course, but the ramp up has been very slow. Now, with this latest development, health officials are certainly hoping no more.
And I get choked up sometimes for what you're doing, and you're risking your lives.
A pep talk of sorts for Middlesex County health workers. This group on the front lines introducing a saliva test for coronavirus, considered a game changer and expected to go nationwide.
This is a major breakthrough. This is a big hit against the coronavirus.
As this animation shows, someone symptomatic can simply spit saliva into a tube. And yet Governor Murphy said today,
it is not where it needs to be from day one. We haven't had the support that we would have wanted, ideally, particularly from the federal government, to have been able to do the universal testings.
Rutgers partnering with South Plainfield-based Accurate Diagnostic Labs and Middlesex County. These kits are simple, easily manufactured glass vials with a just as easily manufactured liquid agent inside, 100% accurate. No longer will these frontline workers have to stick long swabs up people's noses to get testing samples. Just hand them the tubes through a crack in the car window and take it back. Despite the ease, they're not home testing kits.
One, you must have a healthcare professional. Two, it must be under their guidance, and then it comes back to our lab.
It's a huge break for the health workers doing the testing, no longer having to get up close and personal to ill patients with those nose swabs. Even in full PPE, being exposed to sneezing, even vomiting, having to change their protective gear. Some have actually gotten sick either here or exposure elsewhere.
Fortunately, all our people have recovered. Many of them are back on the job already.
One sign of hope right now is that South Brunswick here in Middlesex County tweeted this afternoon that for the first time in a month, it did not record a new case of COVID-19. One other thing, Governor Murphy at his news conference today said by tomorrow he should be able to announce what's going to happen to the schools the rest of the school year here in New Jersey. We will wait to hear what he says then. Live in Edison, Brian Thompson, News 4 New York.
All right, Brian, thank you very much. Well, Connecticut now has nearly 15,000 confirmed cases of COVID-19, nearly half of them in Fairfield County. Health officials say the death toll in Connecticut is now 868. That includes 365 in Fairfield. At his news conference this afternoon, Governor Lamont said a flare-up in one particular community is responsible for part of the increase in the county.
Fairfield, you see, was flattening out. Fairfield County just a week ago, and today you see it ramping up a little bit. And I described recently that was a bit due to the flare-up in Bridgeport.
Lamont also said that if they're not already doing so, all workers who interact with the public should start wearing those face masks.